MHPSS is a community of interdisciplinary researchers, healthcare providers, and also community organizers committed to identifying and addressing the adverse impacts of the climate crisis on mental health. And at the MHPSS, our purposes are threefold. One, to conduct equity-based climate emotions and well-being research. The second is to incubate novel interventions and policy ideas to address the mental health impacts of climate change. And third is to facilitate the knowledge exchange and mobilization to support Canadians who are experiencing climate-related ecological distress. For those of you who joined days 1 and 2 of the summit, as you know, they went really well. We've had some amazing workshops and presentations. There's a really nice mix of academic and non-academic presentations. And for those of you who weren't able to make it, don't stress. We will have recordings available on our website, and we'll send out an email to remind people of that and let them know where to find those recordings. As we heard from day 1 and day 2, we've been hearing, over and over again, the need for collective action in order to move forward. The need for resources to support people so that we can support each other in order to not burn out. The world is really heavy right now, and there's a lot going on. So if we rise to the occasion and support each other, we can really make a difference. And it's been so wonderful to see that message coming through again and again in the work that different people are doing. I hope you're ready for another day of learnings and discussion. It's a really great opportunity to make connections with others. I've been loving how people are connecting in the chat and in the small breakout room. So it's really nice to see people moving these discussions further and moving them offline, maybe into real life. So it's been really great to see. I'm joined today by Kaylee Higgs, our project lead at MHCCA, and she's someone that many of you will recognize. She's been doing a lot of the work, a lot of the heavy lifting on the summit, and she's truly amazing. So thanks, Kaylee. And Kaylee will be supporting tech and logistics today. Please feel free to message her if you have any issues or questions. And if you're a presenter and you haven't let her know that you're here, please send her a quick message. Say, hey, Kaylee, I'm here. I'm ready. Don't worry about me. All good. And it'll just help things move really smoothly. So to start our day, I'd like to take a moment to invite all of us to connect with the lands and communities where we're calling from. While we're all joining here in this virtual space today, we're also all connected to physical places, lands, histories, communities, and our relationships with these places. As Janelle Lapointe so beautifully presented on day 1 in our land acknowledgement, these relationships underlie all of our work and how we continue to show up in the world, which includes impacting mental health and climate change. Climate change and colonialism are deeply intertwined, as are the mental health impacts of them. Indigenous peoples have already experienced drastic environmental impacts due to colonialism and are longstanding and essential leaders on climate justice. These contexts and connections underlie our work and goals around health and climate, and we're going to talk about that more today. So I invite you to notice the points of your body in contact with the earth, or have a look at a living thing either in your house or outside, and take a deep breath and reflect on where you are, your relationships with this place, and how these conversations on climate and well-being that we're continuing to have this week directly relate to collective action, community care, relationships with land and community, decolonization, and ways you can relate or how you relate to the places and communities where you are. So now I just invite everybody to just take a moment to breathe, think about where you are, and get ready for a day of discussion and exploration. To continue these discussions and reflect further relationships about communities, I'll now turn it over to our panelists for a series around the theme of mobilizing communities for resilience. Presenters and panelists today or this morning include representatives from the Canadian Mental Health Association, First Nations Health Authority, Provincial Psychosocial Services, HEMBC, Salvation Army, and United Way. I'll now turn it over to Emily Pletch from the Canadian Mental Health Association to welcome our panel. Thanks very much.
Good morning. Thank you so much, everyone. We're so excited to be here this morning. I'm going to pass off our presentation to Nicole Cahoose that's going to start us off, and Jody to share her screen for our presentation. And we're really grateful to be here today with all of you.
Thank you, and good morning, everyone. I would like to welcome you to our presentation on mobilizing communities for resilience, collaborative approaches to mental health and recovery. As Emily mentioned, my name is Nicole Cahoose, and I come from the Daaketh Nation. I'm calling in today from the beautiful and unceded territory of the Tecumseh-Tishikwetmik, also known as Kamloops, BC. I would first like to start by expressing my gratitude to the organizers for this event for creating this space and bringing us together to talk about mental health and climate change. And so with that, it's an honor to welcome you to our session and excited to share a little bit more with you about our panel. Yeah, so we can move to the next slide, please. There we go. So today with the panel that we have formed today are part of a larger support network. So the folks that you see represented in the labels at the logos at the bottom of the screen are the Health Emergency Management BC, FNHA, United Way, Canadian Red Cross, the Salvation Army, and the Canadian Mental Health Association. We have on this panel, Jody Boyle from the Provincial Health Services Authority, Christy Rintoul from the United Way, Emily Pletch from the Canadian Mental Health Association, Sarah Hamid Balma from the Canadian Mental Health Association. Kate Steen is with us on the chat in case any questions come up, representing the Canadian Red Cross, and myself, Nicole Cahoose, with the First Nations Health Authority. So the MHPSS represents different organizations who partner to collaborate, share expertise, and work on a coordinated response for communities who are in crises. So with that, also just wanted to mention that this group I'm really proud to say that we bring a wealth of expertise into this topic of mental health and climate change, from international experience to the local community response. And to get into the territorial acknowledgement, I just wanted to thank you, Alexis, for doing that land acknowledgement, and just reminding that as we acknowledge the First Nations people in their traditional and unceded lands, and taking a moment to look at where we are situated today. What is the name of the traditional name of that land, or what are the traditional name of the nation, and what are the teachings that they teach us? With that pause and reflection, we give respect to those who have stewarded the land and continue to protect that land. I'm from the Daaketh Nation, and a little bit about my First Nations teachings is, well, first of all, Daaketh means people of the land. And in my culture, we have laws that are enacted in our potlatch system. And these laws remind us of the importance of upholding reciprocal relationships with the land and with each other. They teach us that the land is related, the health of the land is directly related to the health of ourselves, so that the health of ourselves is directly related to the health of the land and the environment. So as we acknowledge these teachings, they remind us to give gratitude and honor the gifts of the land, to recognize that all things are connected, including our past, our present, and our future, and to take only what we need, and to give back what we have taken, and to leave the land as if we were never there, and to use our resources wisely. When I was growing up, my family would camp and, do hunting and fishing, and like our whole family, my grandmother included. And every time we would leave a camp, my grandmother would sweep the area with the boughs and things. And I would ask her, why would we do that? And she would say, well, we have to leave it like we were never here. And now when I think about all of these teachings and laws, it really makes sense. And most importantly, we're taught in our culture to walk gently with the land and with each other. So I just wanted to share a little bit about that with you, but also to remind us all that land acknowledgements are more than words, that they are a call to action, and they remind us of our responsibility to listen, to learn, and to commit to meaningful reconciliation. So with gratitude, I welcome you into this space today as we move forward in the spirit of collaboration and healing and working together. And so as we get into today's discussions, I just encourage us all to listen with open hearts and open minds. And beyond listening, let's also commit to action and ensure that we uphold these teachings for future generations, but also that we come away today with a bigger network of support. And with that, I will hand it over to Jody, who will explain to you a little bit more about what we're going to be talking about today. Thank you.
Thank you, Nicole. Good morning, everyone. So I have the pleasure to tell you, give a bit of an outline. I know most people are expecting just a panel, but we decided to do a little bit of an intro on the work that we've been doing before we move into the panel, just to get everyone on the same page. We have done our very best to make sure that we've not included photos that might be very triggering for some people. Lots of emergency management slides have things like flames and whatnot in them, but we've removed that. But this is, we are talking about human suffering in the context of emergencies. So make sure you take care of yourself, take the time that you need, and reach out if you need support. So we're going to first talk about the emergency management cycle. I'll go over that briefly. The impact of emergencies on humans at multiple levels. MHPSS as a field, I recognize that is a new acronym for some people. We're going to talk about the model that we use and the layers of support, explain that briefly, and then what it looks like to implement that, which is likely why you're all here, implement that here in BC and what we're doing together, and really what helps. So what does this all boil down to? What helps in emergencies to make people or help people cope better? All right, so what is MHPSS? Aside from just a really cool 5-letter acronym that we like to stump our firefighter friends with. So the mental health component, so it's really 2 components, the mental health and the psychosocial support. So the mental health is really the psychology and the psychological and emotional well-being, our coping and our resilience in any form of emergency. So whether it's a disaster or a conflict, for example, an attack of some sort. And the PSS, the psychosocial support, you might see it as a PSS, is really the interventions and the services, the community context, the societal structure, all of the other elements that really support us as humans. So it's really looking at how are you coping, and how are you able to function in that environment despite whatever is happening. So we have a question for you. How can a knitting club protect people in a climate emergency? So I'll just have you write in the chat. I know this is a bit of an oddball question. We do have one of our colleagues monitoring the chat. So you can write it in the chat. I'll have you think about it. We are going to come back to this question later. This is a fun one. So as relates to emergencies, emergency management has always been seen as mostly has been seen as a cycle. So with 4 distinct elements. So there's a preparedness where where you recruit volunteers, you get ready, you're doing training and exercise, working together to get ready for whatever is going to happen. There's we've not always been great at this component, but we're getting better at it. And then the response piece. So response is everything encompassing from the moment of impact, the evacuations, and all of the moving parts. So sheltering, getting people out of the area, communications. Those are the really busy, complex pieces. Moving into recovery, just as busy, just as complex, and that's returning back to baseline. And then more recently, they've looked at disaster risk reduction, mitigation, and saying, hey, let's try and avoid all of this stuff in the future. We definitely have some more work to do there. So the reason I mention this is that, as we know, these disasters are occurring more and more frequently. So the cycle is no longer this nice, distinct cycle. It's actually looks a lot more like a tornado. You have that overlaid upon a heat dome, which requires its own preparedness, response, recovery, mitigation. There's a drug poisoning epidemic we're dealing with right now, pandemics. So you get this layering effect. And the reason this is relevant is that our emergency management system, including the funding cycles, the volunteers we rely on, really are based on this old system. So it's quite important whenever you think about all of your structures to respond to these disasters or these emergencies are based on an outdated model. With longer disaster seasons, it's a lot harder to get a volunteer to commit to, all year round. So how do emergencies impact us? Generally, we think about it at 3 separate levels, separate but interconnected levels. So as an individual being impacted by a disaster it's not a one-time event. It's that one-time stressor, the grief and the shock, navigating loss, but really it's the beginning of the work for a lot of people. So paperwork, decision-making, and all the things that go along with emergency recovery. So when individuals are struggling, maybe they're dealing with these other things or they're just struggling in general. I mean, think right now, a lot of you likely have people that you know in your lives that are just not doing well. It's going to be really hard for them to navigate dealing with a disaster on top of whatever life is already throwing at them. And so it gets harder and harder to have bandwidth to then support other people. So a lot of our relationships rely on at least not everybody doing poorly at the same time. And human beings we're social beings, and this impacts our ability to function when we're dealing with things like this. So relationships, caregiving, your ability to contribute to community, your ability to support someone else in your household, which really leads to a lot of withdrawal and isolation at the time when we need community most and at the time when community needs us most. When we're looking at the household level, we know that stress impacts relationships. And you start looking at compounding stressors. So caregiver strain, dealing with parenting day in and day out of a child that's really upset because there's a lot of changes happening, or caregiving to an older adult as well. So it all relates to how people are managing these new set of circumstances they find themselves in. So the secondary consequences we talk about are really related to the stress of the event. And they start looking at interpersonal stuff. So substance use. Substance use goes up. I always call it the big 3. Substance use, violence, and mental health conditions are all 3 that are exacerbated during a disaster. And of course, they have interesting interplays amongst themselves. So it's the consequences of these secondary impacts can actually often be more intense than the original impact, than the original disaster. So the social consequences are significant. Disasters also impact organizations. So looking at the community level. So when you need your food bank the most, it might be under 3 feet of water. or your AA meeting the most, or your faith group the most, they might not be available. They might also be evacuated, right? These organizations are made of humans that are also impacted by disasters. So communities and households and individuals all group together in an ecosystem. And an emergency magnifies everything. And it also removes protective factors. So when we think of during the pandemic, there was a massive decrease in reporting in child protection issues. Part of that was because nobody had eyes on children, right? So it wasn't a good thing. So that's a good example of some protective factors being removed, is you just don't have people that know other people and know who they should be looking for, who's missing. So these events universally lead to significant increases in baseline stressors. And in some cases, it's people experiencing mental illness for the first time.
Jody, I know we've got a question for the audience in our poll here that relates to
Right.
what you've been talking about. So I think I'm going to launch that just because we're
Yes,
curious
please
about
do.
some of our perspectives around the impacts here. Oh, okay, we have both questions at the same time. So maybe,
We'll just go with the first one.
okay. We're going to start with the first one, and the second question's going to,
Yeah, the second question is meant for a slide that comes up in a minute, so don't worry about the second question.
oh, this is really interesting.
Should we come back and read it in a minute?
Yeah.
People are going to change their answer. Right, on to the next slide. So we know that ecosystems or communities look much more like an ecosystem than sort of three distinct levels. And if you want to read some really interesting research papers, this is probably the only group that I ever get to speak to that would be interested in that. But there's Dr. Rob Gordon writes about the social process theory and just even the proximity of being next to your neighbor. When communities are evacuated, they do scatter. They can be put in shelters. They stay at friends' houses. But the protective factors that were present at the time, all those social bonds can be broken. So that this actually means that, so by definition, disasters are a community event. If it was just a one-time impact, it would be called a trauma or an accident. And the point of it is that it impacts all of those systems at once. So the core work of recovering from a disaster is actually repairing that community structure, rebuilding that web. And to the theme of the conference, relationships matter. Here is our other slide. So I'm curious how many of you have seen this diagram before. This is my version of it. So I modified it from an original SAMHSA diagram. The source is kind of not visible down there, but I'm curious. Are we able to bring up the poll?
Yes. Yes, I'm going to share the first results here, and then we could launch, we can see about launching that second question again.
All right. We have most people experiencing, or the belief that most people experience, 58% say most people experience PTSD following a climate emergency. 28% say no, and 14% are I don't. And oh, it's exciting. I get to share this for the first time to 72% of you. All right, we can pull that down there, Emily.
Okay, here's our second question. We're gonna.
Yep, we have 72%.
I know
so I'll just drop down.
Stop
I'm not sure if that was visible to everybody, but it was 72% had not seen this diagram before.
We're relaunching it because we have it on the screen now.
There you go. So
yeah,
are people able to see that? Yeah, 26%, 24%, 23% said no. Okay, so we'll pull that down. So this graph graph represents the emotional range that people typically go through kind of before, during, and after a disaster. This is, so you can see the red line there is actually the disaster impact. So you have preparedness and mitigation efforts. So my experience in Victoria of threat might be quite a bit different than someone who's living in the interior of BC that has seen subsequent wildfires and evacuations. So their stress level, and sorry, on the left axis, this is sort of emotional highs and emotional lows. So they might be stressed out for weeks, smelling smoke before they're in a position to be evacuated, and it starts impacting their community directly with the fire. So there's a disaster impact. There's this period of heroic sensation where it's actually adrenaline driven, oxytocin driven as well. And it's this community cohesion that, like, we're working together, we can do this. This is a really addictive energy, and why a lot of people get involved in emergency response. This feels incredible and is really, really moving to see. The stories that come out are pretty remarkable. And then that adrenaline wears off, the energy wears off, and there's a lot of other dynamics that happen, but often it's criticizing what people have done or what they haven't done. And that starts to really dive. And people also start doing an inventory. They reach out to their insurance, or maybe they didn't have insurance, or they realized that they missed a deadline in there. And they take a bit of a stock between what I had before and then what I'm going to be able to have now in my quote unquote new normal. There's this disillusionment that happens. People work through grief, and then you'll see little blips there. There'll be a triggering event, for example, a controlled burn, and smoke in the air, someone having a campfire maybe, and it's, they're not well for a couple of days, and then as well. But this is at the community level, right? Smoke in an area can impact a whole bunch of people. And then anniversary events. Anniversaries are reliably a low for folks, which is why we intentionally celebrate those and bring people together. And Christy with United Way will talk a little bit more about those efforts. So the big question is, how long does this take for recovery? The original thought, so when the original version of this is actually 1 to 3 years, they say, and even that was considered, wow, 3 years, right? So most recovery funding is 1 year, 6 months to 1 year. But what we're seeing is it's actually closer to 6, 7 years, and up to 10 now is what they think. It's really hard to measure this because when this first came out, it was built on a single event. And that doesn't really happen anymore in the same way, which really makes you think the tail end of that graph, where people are still kind of working through grief. What happens if you overlay another event on top of that, right? Then you start, and you don't have time, or those people that are still trying to recover from the disaster are now responsible for doing mitigation and preparedness. So it gets heavy really quickly. So this is why we ask the question, right? Do most people get PTSD? You can see where that would actually make sense in this. This is intense stuff. So despite this, most people actually do well with basic supports. So this is a pyramid model that you'll see. Again, it mirrors the intervention pyramid that we use. And it really outlines the proportion of people that typically have each level. Again, the research on all of this has been done on single events. There's very few that have been done on multiple events. And if they are, the timing's different, the severity is different, the level of impact's different. So it's really hard to measure and do good research on these events. So most people do quite well. They are evacuated. They might be really afraid, but with calm, with friendships, with community, with relationships around them. So the bottom two layers can be managed typically with peer supports or with community supports. So they might have a short-term stress reaction. It might be very severe, but it's shorter term, and they don't need longer-term supports. as you move up the pyramid, you have conditions that actually turn into much more serious, but they're short term. Still, in the grand scheme of things, they might be quite distressing for the individual dealing with them. And then persistent mental health disorders. So people that are existing within the community right now. So we have 1 in 5, which is likely also underreported, deal with a mental illness. I believe it's 1 to 4 now. Sarah's nodding at me. Thank you, Sarah. So when you think of that makes a lot of sense, and that people are already dealing with things. A disaster is never going to make it better. It's always going to add fuel to whatever fire the person's dealing with. Oh, that's a terrible analogy. So dealing with persistent mental health disorders, those folks at the top 2 will likely need more serious and more targeted mental health supports. If you remember anything from this, it's early and appropriate intervention universally leads to better outcomes in all of this. It makes the transitory distress shorter, and it decreases severity as well. Right, over to you, Nicole.
Thank you, Jody, for explaining to us so eloquently the impacts of mental health and emergencies. So now we're going to talk a little bit about the disproportionate impacts of disasters. And as Jody had mentioned earlier, marginalized populations are often the first impacted. And then we know that they're also the least to get service, or the least to get response. And this is why it's so important that we talk about this today, because resilience isn't just about emergency response. It's about ensuring that mental health and psychosocial supports are accessible before, during, and after crises. We also know that emergencies take a deep toll on Indigenous peoples, and that's because we face displacement upon displacement and loss upon loss, and not to mention all of the other traumas and atrocities, and specifically related to the loss of traditional lands and so on. We see that women and children are largely impacted, especially because, or for the ones that are that experience heightened vulnerabilities. And then we also see that elders or seniors and people with health conditions who struggle to evacuate are largely impacted. Sometimes we see folks where climate disasters don't just mean losing homes, it means they're losing their culture, their connection, their food security, and their livelihood. So these folks are people who already face systemic barriers, and they're likely people who are unhoused or struggling with addictions. And so all of these populations are the people that are getting hit the hardest. And again, as Jody mentioned, climate change magnifies these inequities. And so if we know that these gaps exist, why aren't supports already in place? And why are they the least or the last to receive support? So that's the question and the answer that we need to act on. Next slide, please. So to better understand that question and that relationship between social determinants of health and intersectionality, it helps us to understand the broader systemic barriers that shape disaster experiences and recovery outcomes. We know that these 12 key social determinants are vital to overall wellness. We also know that they create different impacts for different groups. So the likelihood of experiencing a disaster, its impact, the recovery process are all influenced by these social determinants. Emergency management previously and often overlooked mental health needs, but we know that recovery depends on mental health, which is directly influenced by a range of all of these social factors that you see. So disasters don't just cause destruction, they expose and they widen inequities, social inequities. Social determinants of health shapes who is most at risk, and it affects how disasters impact them and the recovery process. So let's imagine for a minute a 23-year-old First Nations woman from a remote community. When wildfires force her to evacuate, she has no transportation, she has low income, she struggles with PTSD, she struggles with grief and loss, she's got added mental health strain because of the displacement, she is a renter and she isn't eligible for low insurance benefits. The evacuation center just makes her feel like a fish out of water. There isn't really any kind of culturally safe support. This example isn't an isolated case example. Many people face displacement, financial instability, and feel that lack of culturally safe support systems. So if we take a look at, say, in 2021, when BC was flooding, the migrant workers were hit the hardest. They were already struggling with housing and systemic barriers. And I couldn't imagine what it would be like if I was in another country and I didn't speak English and all of the emergency alerts and everything were in another language that I didn't understand. Like, I don't know what that would feel like or how I would get help. So climate change and mental health related emergencies, they aren't just in an environmental crisis. It's a crisis of inequity. Next slide, please. So we see the impacts of the disproportionate effects of emergencies based on race, sexual orientation, class, religion, culture. I'd like to add gender identity, age, socioeconomic status, ability, and geographic location. Privilege often makes inequities invisible, especially to those who don't experience those barriers firsthand. People don't usually experience discrimination based on one of those single identities, but through the overlapping of these social locations. So health inequities disproportionately affects marginalized communities and populations. And so why is this important, or why does this matter in disaster response? I think it's because recognizing the intersection of social determinants and systemic inequities are essential to creating more equitable disaster responses. So recognizing that relationship helps us to prioritize and focus more on relying on proactive and preventative strategies that address some of the root causes of these health disparities. It also means that we maybe need to focus on advocating for anti-oppressive policies and culturally responsive care models, or community-driven solutions that support those most impacted. So when social determinants overlap, marginalization is magnified. This is intersectionality in action. Disaster response programs must acknowledge that inequities are not incidental, but are deeply rooted in systemic barriers. And so to build resilient communities, we need to address these challenges, and we need to transform the systems that create those barriers collectively. And resilience isn't just about emergency response. It's about ensuring mental health and psychosocial supports are embedded and accessible before, during, and after crises. And so with that, I will hand it over to Jody or is it Emily? Sorry. And they'll explain the mental health and psychosocial support services model. Thank you.
Thank you so much, Nicole, for all that really, really important sharing that is truly the foundation of this work and understanding and our approaches. So I'd like to share a little bit about the Interagency Standing Committee, which is a group that formalizes practices to support in a disaster. And they've been around for over 30 years. They collect data, they record lessons, and advise and promote on best practices in MHPSS, mental health psychosocial support in emergencies. So even though they are an international body, this work is directly relevant to our context here. And we're going to share this reference guide. Sarah has shared it in the chat. And this just really helps explain the field a bit more in depth and ways to integrate these practices into your own response and recovery in your own community. So we can go to the next slide. And we're going to look at these are the principles of the Interagency Standing Committee. So as a working group, we collectively agree on these principles for our group and align with them. And the principles really work to promote autonomy and choice, which is something that you are losing in a disaster, by protecting and strengthening opportunities for trust-based consultation, informed decision-making, and this multi-layered supports piece is really, we're going to go back to that pyramid that we talked to before with Jody, and really means that there are higher levels of care and support available to those who need it. And we're gonna dig into some of what that means, and we can go to the next slide to do that, Jody. So this is the model of the Interagency Standing Committee, and with reference to MHPSS, it's a pyramid that illustrates the different range of supports needed to address mental health and psychosocial supports during, after, in distressing events. So it's made up of those different layers that Christy and I are really going to delve into what each of them kind of can look like in community, how they're showing up. And each size of the layer, as Jody shared, is the amount of supports that we need, and we need them all kind of at the same time. And anyone who's needs those specialized care at the top of the pyramid still needs everything underneath it. And some people might just be able to benefit from simple psychosocial support, learning how they can cope during an emergency, how they can support others and those around them, getting connected to the people that they love, having some of their routines put in place, being able to rely on those social and cultural supports, while others might need more of that really one-to-one support, that care. So all of this is to happen kind of at the exact same time in an emergency, and to be able to pick up on who needs that higher level of care and having those referral systems in place to provide those different supports. So we're going to kick it off to Christy.
Thanks, everybody. So I think it's pretty obvious why now. I have the easy slide. We're all here attending this summit, and if you've been here for the last couple of days, you've heard it and you know it, because there's devastating impacts of climate change, and we know that these impacts are showing up in an increase in climate-related events. So these large-scale emergencies are happening more often, more people are being impacted, and there's less time to recover before the next emergency hits and affects whole communities. As mentioned, compounding health emergencies like COVID and toxic drug poisoning crisis, as well as environmental crisis disasters like floods and fires. I want to recognize that I'm joining the call today from the unceded ancestral territories of Tk'emlúps te Secwépemc, also known as Kamloops, BC, and every single summer, our reception center is open to welcome folks being evacuated in communities around our municipality. We're left with longer and more unpredictable disaster periods, higher alerts, longer activations, and as shared by Jody earlier, there's more and more demand on local governments, regional health districts, social services, and charities. And we know that no one organization can respond to all of the needs. So there's more demand for the mental health and psychosocial supports on communities as a whole. And that means that we need to come together and collaborate in ways to support folks, especially more folks who are facing more vulnerabilities, in a collaborative way. Next slide. So looking back at that framework here, we're going to go to the baseline there, the one where most folks potentially are affected through those social considerations and basic services and security. And what does this look like during an evacuation or a major event? So starting at the basics, this level of the pyramid affects the most people. If you're evacuated, no matter who you are required to register at a reception center in a host community. Things are moving online now, so folks can register online, but that also is dependent upon your ability to access the internet and where you are located when that evacuation occurs. And, and I've been there. I don't know how many of you have been on this call, or you've been in a reception center, or you've been lined up as the picture shows here. It's pretty scary. And people are all facing different types of trauma based on where they're coming from. And as mentioned earlier, some of those effects of compounding issues that have brought them to this position and to this situation. So depending on, where you are, whether you may see people sleeping in their cars, lineups out the door. So how can we make sure that we're holding up some of the core principles of the MHSS model, making sure that we're finding ways to get people what they need without causing harm, being open and flexible to different needs of different people coming into that spaces. So making sure when folks are accessing emergency supports that there's respect and kindness, connection, opportunities to access cultural support, safe spaces, and elders in some rooms that are available for folks to receive some smudging, other faith-based organizations on site, making sure there's culturally appropriate food, and then keeping people together. So when they're being evacuated, making sure that if they're being put in a hotel, that they're being put in the same hotel as other people from their community is so incredibly important in that response period. Making sure that you can safely include familiar faces, and that there's information about other levels of support and how to access those supports in those communities when folks are entering those communities. Inclusion and equity needs to be that key focus of any of those response and recovery operations, and also recognizing who's missing and how can we increase that safety and that equity. Next slide, please. So then we move up into the next level of the pyramid, which is strengthening community and family supports. So for a lot of folks, like we said, once you've received those basic necessities, you've registered at ESS, you've been able to get into a hotel or stay with family and friends, that may be where your level of need stops. But for a lot of other folks, it's not. And so making sure that we have a dedicated space for folks is really important. So, an example here is a movie night during a response. So people can still come together out of their hotel rooms or out of wherever they've been put in shelter to be together in that and create that social connectedness opportunity. We also need to make sure that that we have sorry, I've lost my spot here. Making sure that there's also opportunities for people to connect with others and to give back as well. So we see, folks sandbagging. If you are evacuated or if you're in a community that you can support others, coming together again to help. Like Jody mentioned, when we look at those different different ranges during the event itself, that heroic area where folks are really energized being able to support and help. So making sure you're offering opportunities to bring people together and to connect them in those spaces. Dr. Lindsay Galloway spoke really eloquently during her presentation earlier in the summit around collective coping in an effort to combat that climate of silence. And so for a lot of these folks coming into new communities, potentially from more rural and remote regions, there's a lot of pride and there's a lot of stigma around mental health. So making sure that there's resources available for folks, but that they're not necessarily labeled mental health resources, that it's really more just around folks being able to pick up pamphlets or talk to folks who are there, making sure those resources, we call them the purple shirts, the DPS, psychosocial counselors are on site. But it's not in a way that would potentially be making people feel uncomfortable accessing those things. Next slide, please. So what has this looked like for us here in BC over the last few years? We know that this isn't just about response. This is also about, as mentioned, the recovery period. And as folks return home after an evacuation, just as important to keep those opportunities to connect available and the social connectedness and building back those the social infrastructure as well as the physical infrastructure of communities that may be affected by climate-related disaster. So understanding that these communities and family supports are needed during and after the event. United Way is committed to being in some of the hardest hit communities here in BC. So we have folks in and around the Lytton area, Merritt, the Shuswap, which was affected by wildfire just in 2023, Princeton and other areas. And we know that we need to be in those areas, not only because local folks are affected long after the wildfire, but also because it's important to have people who who have been affected by climate disaster, who live in those areas, and make sure they have access to resources years after those events. So some examples of how we've been able to bring that social connectedness opportunities to those areas through staff that we've hired from those regions. So these are some pictures from some of those examples. One that I like to hold up is, we were able to bring Santa to Lytton after the fires, just making sure there's some normalcy so people don't have to travel 2 hours outside of the community to get a picture with Santa, that those who were able to still stay in that community had that opportunity to go get photos with Santa in their own community, making sure that there's anniversary events. So Jody mentioned that 1 year, 2 years, 3 years, the anniversary of when the evacuation occurred can be incredibly triggering for people. So making sure that we mark those anniversaries by providing resources for people to come together for potlatch or celebration. And again, making sure that there's mental health supports there during those events as well to support people as they grieve, but also as they celebrate how far they have come through their recovery. Also, having movie nights, lunches, dances. We've got some quotes here just on the slide to show how impactful for that can be for people, that it's so much more than coming together and eating. And I think everyone here on this call that knows that sharing large community meals together is really about that connectedness, and that everyone there has gone through something together. So being able to share in that space and share that community is so important for years after an event. Back to you, Emily.
Thank you so much, Christy, for sharing that and shedding light on how this is happening. This is work that we're a part of, and a way that. So one example in BC of how groups are coming together, this is through a social sector activation guide. And it really works to support impacted communities. And we're going to share this guide in the chat. Sarah's going to share it. And then the first link there is on the United Way BC website. They have some great emergency preparedness guides on there. And they also have the social sector guide. We will premise the guide is going to go through a little bit of an update just to keep it relevant and up to speed on everything that's happening and where you get information these days. So this is a simple breakdown of the guide, and it's really based on having an intentional equity-based approach is the foundation for this work, having trauma-informed approaches, fostering cultural safety, relationality, building those relationships, knowing who is who's going to come to your community is probably within an hour or two away. And do you know who those folks are? Do you have some of those regional relationships in place? So when they call you, they know who you are. And really having that role clarity before an event. So if something happens, who is who in our community and what can we offer during that event? And just having some of those conversations beforehand and establishing those collaborative response systems. So then when it does happen, that system's already in place and you can just activate it and get those folks together to increase those supports that are available to evacuees. And it really just works to help the local community social sector to collaborate and work alongside ESS and governments to create those supports for evacuees. So we can go to the next slide. And this are we're just going to share the last two layers of the pyramid there. I would love to just, if you have questions that are generating, we are going to answer some questions after this, so you're welcome to put those in the Q&A or the chat as we kind of wrap up our presentation here. But so those non-targeted supports, this is still that one-to-one. This is that psychological first aid. This is looking at who in the room maybe isn't doing so good, checking in with people, providing that emotional care. This can be with some of those more formalized agencies that we represent. Is that the Red Cross? Is that Salvation Army? Is that DPS or Canadian Mental Health? This can also be folks that are in community organizations or people in your local church group, Rotary, there are folks that do have those skill sets to connect with folks. And I think part of this work and those integrated systems is having people more trained in that ability to be able to just like support people, be there, listen, connect them to the people that they might be able to get some more support from. And then the top of the pyramid, we can go to the next slide there, Jody, is really that specialized support, who needs that one-to-one care, who might need some psychiatric support, and being able to really pick up on that and having those supports available and knowing who to call to get people the help that they need. And this isn't a big percentage of people that need this, but they also, yes, again, do need everything below as well. And just really keeping an eye on who's out there and looking out for each other and getting people the support they need and having that support in accessible places. Like, is this in the bathroom? Is this in other places? Which I know Sarah's going to talk a little bit more about that. So we're going to pass it off to Sarah.
Thanks, Emily. So what are some of the implications of all of this now that Emily and Jody have so eloquently laid out the parts of the framework? Well, some of these should be fairly obvious. We know, and Jody's reminded us that mental health and substance use, and I know at CMHA, they go hand in hand. And we know that substance use often increases. So having harm reduction approaches and strategies, supplies is key. And increasingly, so the Canadian Mental Health Association, we are a charity and we have 14 branches across BC, 9 in the interior and the north, and they routinely provide harm reduction supplies as well as mental health supports. The second bullet is quite a profound one that I think the social sector guide, one of the reasons for writing it, whether you call it the social sector, the community sector, the voluntary sector, our collaborative that's presenting here today, minus 2 members who are out in the world, and thanks to Salvation Army and Red Cross, but we're primarily nonprofits. And we know that government has an important role to play in emergency management, but we've seen that they're not 100% of the response, nor can they be. And there's also been, since COVID and other political events, more distrust of government and government's roles, which has folks turning more to charities and to the social sector for support. So we are vital during disasters, but we're often not thought of, unfunded, inequitably funded, and there's not really a good coordination plan. So, and the nonprofit sector is also very vulnerable itself during and after disasters. Given that we rely on external resources like volunteers and grants and donations, and all of those are heavily disrupted. And the folks who work at all of these organizations are also from those communities and are personally impacted as well. So just a shout out to remember your local charities and yeah, donor fatigue and all of the competition and fatigue and exhaustion impacts everybody. The other bullets, I think, fewer resources. We put so much energy into response, that kind of the active disaster phase, and then there's less attention, less funding, big gaps and lags in funding to support recovery, right? So we're now seeing funding cycles coming to support communities from the 2021 floods, right? Like, so we're talking about 3-4 years later, do communities get an infusion of support? And that's usually 6 months to a year, which is also very difficult to bring in support and then have those supports leave. We need to focus on peer-based approaches, community-led approaches, neighbors helping neighbors. And as Nicole so eloquently has said in her sections, that focus on cultural safety and trauma-informed care. The relationship to the land is central to all of us. It's vital for our life, but is, doubly vital for Indigenous communities and their sense of well-being. And we need to walk alongside our Indigenous friends and neighbors and leaders And we also need to remember, and you'll never see in our materials, these aren't natural disasters anymore. That phrase is not relevant anymore. Natural implies that they're normal, expected, out of our control, and that we aren't actually all complicit, and that colonialism hasn't increased and compounded all of these things. So there is a connection between our behavior, our policies, and what's happening to our planet. And what hasn't been said is that we have the toxic drug crisis, we have the pandemic, we've had food insecurity and the rising cost of living, but there's also compounding traumas that people have been facing because let's say there's been an event and a climate emergency, and it's also led to layoffs at the mill, or there's been suicide death in a community as a result of either economic loss or an emergency, and a suicide loss or an economic loss. Those are huge. It's not just property. It's not just loss of life. It's all of those disruptions, and the grief it can be compounded in many, many horrible ways. Psychological first aid training, I just want to briefly say, because it took me a while to understand, mental health first aid training, they sound really similar. Mental health first aid is training around increasing mental health literacy around mental health conditions. Psychological first aid sounds really similar, but is specifically training on sort of managing distress and social and emotional connection to people during and after disasters. So it's primarily for those first responders. But we see now that it needs to go beyond traditional first responders. Anyone can be a mental health support, can manage distress, can be that friendly, non-judgmental, caring person, could be the person giving you food or water, or playing with your kids at a reception or evacuation center. It does not have to be the counselor, it does not have to be the firefighter. Who are all those second responders? Who are all those third responders? Who are all those community leaders who could benefit from psychological first aid? CMHA branches are doing this work. They have mental health first aid training. They know how to support people with mental health conditions. Very few of CMHA, the hundreds of CMHA staff in branches, have psychological first aid training, but we're wanting to increase that. And then we have this questions around rebuilding in high-risk areas. So there are places like Lytton and Lillooet and others where they have had such devastating loss or compounding losses that you don't know if you should go back after you've been evacuated. And so the meaning of home changes, and the grief isn't just loss of property, it's also loss of your neighbor, your friend, the person who gave you eggs or looked after your kids or walked your dog. They're now somewhere else, right? And so part of the reason our working group has come together is to try to knit some of these different pieces together in a protective net. So next slide. So this is our, again, at the bottom, these are our working group members. And we came together voluntarily because just a few years ago, we're less than 2 years old. And we really just saw a need that we were all kind of doing work in this space. We weren't at the big government tables all the time, but we saw a need and a role for us to come together and to do some provincial work. We started working together a little bit in 2018, 2019, and yeah, so we're not very old, but we wanted to kind of formalize and anchor and coordinate our work, share information, build relationship. We're doing joint presentations like this. We've developed some joint resources, and we meet occasionally to figure out what's going on and how we can better not duplicate and build on each other's capacities. So I think one of the things that people are like, oh, CMHA is not an emergency management organization. I'm like, well, actually, we kind of have become. And Salvation Army, they're not a mental health support. Like, actually, they kind of are. So it's really rethinking what mental health support means. It's like 95% of mental health support in my long career in mental health is like not happening at the table that says mental health. It's all of those caring connections that we make, all of those little things that we do that help someone to feel better, to feel heard, to feel safe. You do not have to be a mental health specialist to provide mental health support. And so I think next slide. And then we're just about wrapped up. I'm just going to pass it to Jody to close us off. But this is one that we're really excited about, that we some joint work we did last summer. So the URL has been around since 2018, and you can visit that, and Emily can put it in the chat. So bcdisasterstress.ca. We did after the 2017 season. And then we've added this resource last summer to that site, and it's one that we've all collaborated on. And it's a very plain language resource. You can print, download it. Please use it, share it how you would like. We'd love to translate it one day. But it's just normalizing the experience of emergencies. What can you expect? What might help? What do we know from research? And social experience can actually support each other, and what can help children, especially a lot of worry about what we might see or not see in children. And if you need more support than just some of that basic distress normalizing, what are services in your community? Just a few, not a list of 100 things that you might be able to go to. So we hope that this can be a first step. I remember sharing it with my friend who lives near LA, not because the last page will be relevant to him, but just to normalize some of the things he was going through for the first time. It's just, we're also doing another resource. It's coming out in another month or two, on how to talk about disasters in an ethical and trauma-informed way. And we're going to share that with the media, with agencies who communicate around disasters. How can we use plain language and trauma-informed principles to do less harm when we talk about emergencies, because we talk about them a lot. So yeah, that's it for me. I'm going to pass it back to Jody for her last couple slides.
Great. Thank you very much, Sarah. I'm not going to go too much into this, aside from what helps in general. I think this group already has a pretty good idea. We've gone through this throughout the presentation, but really these are called Hobsbawl's principles. Some people might recognize them, but it's that sense of safety that's foundational. You will not be able to help someone be calm if they're still needing to evacuate. So that whatever you can do to create this sense, the calming sense of self-efficacy, community. If you're running a program, ask the big three questions: who's it for, who benefits, and who decides? And those all three should line up, and then you'll likely have a good program. Bring people together and provide hope. So this is not, as Sarah said, this is not, you don't need a PhD in psychology to be able to do this. Everybody benefits from this. I'm just going to just show back to our framework slide for a second. Really, as these folks have said, it's the bottom components of these pyramid that are dealing with the bulk of the individuals. And even the people at the top two levels need that base. So having things like barbecues, we mentioned outdoor movie nights. Reception centers are typically very quiet after the first couple of days and people have registered. But this really, thinking beyond what is typical, why not have a movie night in your reception center and make sure everybody can join safely? Earmuffs for people that need them. And I realize I didn't answer your PTSD question. So the answer is that most people don't get PTSD. Now, with any one person, that doesn't give you a predictor as to whether or not they will get it, that an individual will get it, but there's certain factors, and you can dive right into that subject if you want to. Anyone can email me if they're interested. But really, it's a matter of about between 5 and 38%, I believe. Again, this is one of the tricky ones to study because it varies widely by people's backgrounds pre-disaster, but most people don't. There, to answer that question. And hopefully we can answer, I was looking through the chat when other folks were talking, and I saw some very heartwarming answers to this question around how this protects people in a climate emergencies. And you're absolutely correct. It's that togetherness, that, hey, where is Sarah tonight? Has anyone checked on her lately? knowing other people within your community, that sense of self-efficacy, calmness, look back to HOP goals. And then that's going to be an effective intervention or effective program. This isn't rocket surgery. It's a matter of bringing people together, usually bring food. And this is starting to build community, and it's protective. If anyone else wants another source for that, there's a fantastic book called Palaces for the People by Eric Kleinenberg, who outlines just how these communal spaces really are so protective in a climate emergency context. It's how you know who to check on, who's missing. All right, so we'll jump right into our, I'll stop sharing and we'll jump right into our panel. It looks like we already did have one question.
Yes, we did have a Q&A in the chat.
Do you want to read that question out, Emily?
Yeah, it looks like it's not in the chat, but I have it here. And it's asking about, I just want to make sure. Okay. So it's asking about PFA and critical incident debriefing, stress debriefing, referring to Dr. Don Stee's book, Mind the Science, and writes that there's strong evidence to show that critical incident stress debriefing, or PFA, can worsen post-traumatic stress and anxiety symptoms, perhaps by interfering with the flow of recovery processes that typically occur with the passage of time. He points that many PFA proponents tend to claim that everyone can benefit from the interventions, and poor clinician training or failure to apply the intervention properly is blamed as a way of dismissing the research that is critical of these interventions. What's the current status of the evidence on effectiveness of PFA? Great question.
You want me to take that?
How is it different from critical incident stress debriefing, or how is it similar?
You want me to take that one?
Yeah, if you could start, Jody, and then we could jump in if we have something to add, that'd be great.
Yeah, absolutely. That's a fantastic question. I'm actually glad you brought that up, because critical incident stress debriefing will not die. It was the World Health Organization recommended against it back in 2012, I believe. And it's one of those interventions where the way that it was originally perceived, or the originally done, where services were mandatory. It was mandatory if you have critical incident stress debriefing. If you had an incident, your employer would say you have to sit through this. But they're starting to realize that approach isn't effective. So you have to look at psychological first aid is quite different than critical incident stress debriefing, because those components are missing. It's not mandatory. You don't do it in an acute phase, and you don't ask details. And whenever you actually take out those components, the psychological debriefing component about what happened and going into details of critical incident stress debriefing, the certain steps there, then it is actually psychological first aid, which is kind of cool. So it's one of those, don't throw out the baby with the bathwater. I have horrible analogies today, but they don't want to. There is some good evidence for psychological first aid. It can be done by lay persons, so you need to have some training, but it's really that structured approach, the look, listen, link, live, or the World Health Organization model says prepare. So it's really, so short answer is psychological first aid is the way to go now. It's been used repeatedly. The Interagency Standing Committee recommends it, which has IFRC, all the acronyms, World Health Organization. There's a great link, I can find it here and share it, around critical incident stress debriefing, specifically the psychological debriefing component. So it needs to not be mandatory and not go into details. And not be acute, so not in that acute phase where the person is still, dealing with the trauma. So psychological first aid can be used then, but no form of debriefing is to be done then. So they don't want details. You can certainly ask how people are coping though. Anyone else have something to add to that? I hope that answers your question. I'm happy to, I've not read the book that was referenced there, but I'm going to check it out. Thank you for that question.
Thanks, Jody. We're getting some chats like from Kate and other folks that are adding to what you're saying, which is helpful. So we don't have a ton of questions, but please, yeah, throw them at us if you're interested. This one, Sarah, I thought maybe this could be interesting for you. Do you find it better to refer to disasters or emergencies without linking them to climate change? I always wonder if that language is purposeful to not alienate people who don't believe in climate change.
Oh, that's a great question. I think it depends on your audience, like anything else. Before I worked in health promotion, I worked in communications, and yeah, audience is central. Depends. I do think there are some situations where, unfortunately, as everyone attending here knows, that climate change has become like too many things, deeply partisan or political, when it oughtn't to be. Sometimes we will say environmental emergencies, but we definitely will not say natural disaster. And sometimes you don't need the word climate in front of it. It's quite obvious that you're talking about wildfires, floods, mudslides, heat domes, and again, plain language principles would tell us, like, just let's talk about the thing that people, how do they call it? What do they know it by, right? So if it feels jargony for the people you're talking, don't call it a climate emergency. Talk about it as a wildfire. Talk about it by what it is. But I think it is a small thing we can do to recognize and reinforce the fact that these are not normal, and that we have a role in minimizing them and supporting people and in creating them. So yeah, beware of your audience though, for sure. That's a great question.
Great, thanks, Sarah. We have someone that wants to join the knitting club. It's actually not formalized, I'm sorry to tell you. Maybe it should be. Maybe you'll start it. Jody made a joke yesterday that you can knit your pants. That will help us in emergencies and the direction that we are right now.
It might be a bit drafty though, but I mean, not in cheekiness. Knitting clubs, you did an amazing job in the chat earlier up, telling us all of the benefits. Did you have any other comments, Jody, about the benefits of knitting? I also wanted to add like that intergenerational component. Like it's something that we're seeing a lot of children and older adults teach each other. And that there's also kind of a practical piece of, you might knit toques to help people who are unhoused, going through, winter, a cold snap. Like there are actual practical things, as well as the connection, belonging, community, and tactile pieces that everyone referenced so beautifully.
Yeah, I can, so the value of a knitting club, I can tell a quick little story about a post-disaster community, or it was a community that was a host community actually, several years ago. And one of their executive directors of a social services organization, I won't name it because it's, anyway, people had been given vouchers. Very, very small community, people had been given vouchers and they were all evacuated, vouchers for clothing because they had nothing else to wear. And the vouchers, well intended, that there weren't any stores that they could use it at that had clothes in the size that would fit some of the people. So what the community ended up doing was they got through a phone tree, got a bunch of people together and they sewed them clothes. So they took their sizes and they grabbed a bunch of fabric and they actually sewed their clothes out of other clothes that they had, fabric that they had, which is a really great example of being embraced by a community when you're evacuated and you're in that disillusionment phase or still in the acute stress phase and you have nothing to wear, and how the impact that had. I actually was privileged to get a phone call when they were in the middle of doing all of that, and you can just hear that there was so much joy and laughter in them just preparing that. So people that otherwise might not have had an opportunity to be involved in a disaster response were involved. So really that that it's just an extension of community. Every single one of you was right. A little thumbs up beside you.
We don't have any other questions yet. I'm curious, Christy, if you were to share just the insights on what can people do on their own, what can I take away with this in my own household or in my organization to move this forward for myself and the people around me.
Sure. I mean, I can share that. Oh, sorry, I thought I froze. I can share that, community is so important. I think we can all speak to that, but knowing your neighbors, knowing folks around you, making sure that you have a good plan in place if you are evacuated. But then also if you are a part of the social service sector. So, as Sarah mentioned earlier, charities do a ton for community. We know that, and they're underfunded, over capacity. If you can volunteer, support, work with your local charities, and also work to connect them with local resources if there is an event. So making sure that wherever you are, and this is something that we're doing throughout the province of BC, but wherever you are, if you are connected to a faith-based organization or a local charity, that you're working to make sure that there is some collaboration in that community. So if you are faced with an extreme event, that people know who to reach out to and what they are able to offer. Because once the event happens, we know it's too late to start trying to coordinate people in those spaces. It's too chaotic. And Emily was there with me at the reception center in 2021 when 7,000 folks were evacuated from the township of Merritt into Kamloops. And the lineup was out the door. People were sleeping in their cars. We went inside to try and find the person in charge to see if they needed help. And, she was doing the best she could with her volunteers, but her response was just, I need some mental health supports here. And so when we started trying to pull people in, but it was very reactionary. So preparedness, I guess to answer your question, preparedness is key. So making sure you are prepared with yourself, your family, your friends, your community is prepared, and that you know who can do what in case of a disaster hits.
Thanks so much, Christy. That's fantastic. We do have one question here. Okay. Have you thought about adding TRE, which is TRE, as a practice to help traumatized individuals after a disaster? It's fast, easy, and extremely effective. I'm happy to connect you to the TRE community in BC. Shelley, thank you for this question. I'm not, maybe we need to read more about TRE. If you want to share some resources to it in the chat, we would be happy to look at those and see how it can integrate into this work. Okay, Shelley's sharing more. She's going to share us some resources. Okay, here is a question. Do you have any key learnings for starting a MHPSS working group in our communities/organization?
We have a guide. Thankfully, I will put it in the chat, but thankfully the Interagency Standing Committee has made a manual for having this. There's also a terms of reference for a very local working group, and that was developed, I believe, by United Way back in the 2017 wildfires. So that is still floating around somewhere in our toolkit, so I can get that if I can get the email of whomever. But right now I can put the Interagency Standing Committee. It's a really nice guide. It's very well done and has lots of pictures, which I always like.
Thanks so much, Jody. Kate was just clarifying. Kate's a working group member from the Red Cross, just clarifying about that PFA is not a clinical intervention and the components are look, listen, link, and live as opposed to processing in a therapeutic nature. So there are a bunch of resources in the chat about PFA. There is a shorter online version that you can get certified in, and then opportunities to do either full day trainings or webinars, but there is a good kind of Taster PFA, and someone else shared another one from John Hopkins in the chat as well that I saw. Oh yes, all these resources here. Fantastic. So I know we just have a few minutes left here. If there's any other questions that we'd like or final thoughts from our team members, we're so grateful that you're here today and for engaging in the chat and being here, learning together, supporting one another. We are all in this together. There's a reason that we're all on this call, that we're interested in this work. And we're really glad that you're here to learn together and just really grateful for everyone. If there's any final thoughts.
We did have a slide that we didn't show around, signs of hope. I wonder if someone in our group would like to just speak to some of the things that do give them hope right now, because it is a hard time thinking about now and future years. So anyone want to speak to some of those points briefly as we close?
I'm happy to. And Nicole, oh, you unmuted. You go ahead.
Okay. I just wanted to kind of reiterate the idea that mental health supports doesn't have to be really big and fancy. That we know from studies that the one of the biggest factors in resilience is social connection. And so the earlier we can prepare and we can plan and we can work on that social connection and plan for social connection, the more resilient we can become as caregivers, as supporters, as responders, but even as family members. As climate crises and emergencies increase, the demands are increasing. And that was one of the reasons why this MHPSS group formed, is because we needed a more collaborative approach to be able to talk about ways to address the increasing and demanding needs. But we also know, as mental health professionals on this group, is that social connection is equally or even more important, that the majority of people can overcome difficulties from their helpful social connections. So it really isn't like, this big overwhelming thing. I think that when we look at crisis response, emergency, and the psychology of it, it really is just breaking it down and being as simple about it as possible. And that is why I love that picture of the knitting group of people getting together. They're getting together and they are connecting and they're looking out for each other. And they're doing art. They're doing something creative. And we know that, with knitting or beading in my culture, or even just walking in the forest, that can activate both sides of the brain, which helps us to calm and move into our calm states. And that's one of the beautiful things that I loved about that imagery and that metaphor. Thank you.
I can give just one. The new needs assessment specifically asks about marginal group participation and as well as mental health and psychosocial impacts. So the provincial needs assessment has that. That's a huge one.
Great, thanks everybody. What a great panel. It's lovely to see the active chat and see how everybody, or what sorts of programs are in place and how to really meet people's needs in the event of what's the correct word? There was somebody had written a good one. It's gone from my brain. We'll just say emergency events. So thanks very much for everybody's work there.